Hi, I'm Dr. Bruce Doran from Winnipeg in Canada, and I get asked what preventative measures do I recommend to my patients for OSD. I think OSD, you've got to think of this as being a two-part treatment program. And I like to describe it to my patients a little bit like this analogy. If you go to your general practitioner, your doctor, and your doctor diagnoses you with diabetes, they'll do treatments in their office. They'll prescribe insulin. They'll treat you in their office. But they'll also ask you to go home and do at-home things. Change your diet, exercise, check your blood. You have to poke your finger, check the blood. So there's things that you do in office and there's things you do at home. I think of dry eye as being exactly like that. When you come into our clinic, we're going to do dry eye treatments. We're going to do Forma eye, Lumecca eye, manual gland expressions. But to prevent that condition from regressing or to treat that early, I always recommend patients doing at-home medical grade hot compressing. I like to keep the lid and the lash margin clean and aseptic, so I recommend tea tree foamers. I also recommend hypochlorous acid solutions. I want to keep the lash line very healthy and clean. And I also recommend omega-3s because I believe that's the building block of how we form the lipid layer on the tear film. So I think asking the patient to do at-home things is very preventative. And I also am very proactive about trying to treat patients early, even at that asymptomatic phase. I think that's the key. I don't want to wait till that patient is symptomatic. I want to treat them in the asymptomatic phase so that doesn't progress to that more late stage, more difficult to treat condition.